Well, good morning, everybody. I'm absolutely delighted to be here today, and I want to thank Yan for inviting me. Bowel care is very close to my heart and is actually one of the reasons why I left the NHS about 10 or so years ago. I just got very frustrated as a continence advisor and stoma care nurse working in the community, not being able to do what I wanted to do for the patients in my care because it wasn't on the tick box or the list or the outcome measure that we had to do. And I just got very, very frustrated, so I felt I needed to actually vote with my feet. And actually leaving the NHS and working for the charity was very liberating, and it's enabled us to do a lot of work, both in the community, working with clinicians and patients alike, trying to improve their care. So this is the team. As a charity, we're quite unique in fact that we're clinicians, and some of us work part in the NHS and part in the charity. And we do a lot of work. We're a voluntary organisation working under the umbrella of disabled living, and we provide lots of impartial advice and information. We have some leaflets, and I've left some outside, and we also have a website. And we have a helpline which anybody can ring, patients, carers, healthcare professionals, anybody. If they want to know any information, we can signpost them to. We do a lot of lobbying. This is me a few years ago, bending the ear of David Cameron and Andrew Lansley, trying to get the case over that we need to improve continence care, because actually it's a win-win for everybody. If we improve the care of patients with bladder and bowel problems before those problems become chronic and ending up in secondary care, we can make a huge difference. So how can you as patients and carers actually make a difference? Well, one of the ways is Health Watch, which is the new independent consumer champion, which is created to gather and represent the views of the public. And Health Watch will play a role at both national and local level, and will make sure that the views of the public and people who use services are taken into account. And there's both local and national Health Watch, and this actually helps strengthen the voice of patients and users of services. And to help achieve this, they're bound by local areas, local consumer voice, and Health Watch England will be a national independent consumer champion. Have any of you heard of Health Watch? Anybody here from Health? A few. Great, great. But they're very keen to continue with existing arrangements and have a duty of care to deliver local Health Watch. This looks quite complicated, but it shows how everything all fits into place. Working together, hopefully we can make a difference. And I think the strengths of local Health Watch is it's a clear route to influencing local commissioning and having a direct voice on local health and wellbeing boards. And regulations will make sure that relevant bodies, including Health Watch England, have to respond to information requests or reports or recommendations made by local Health Watch. And the strengths, what are the strengths of having this local voice working both at local and then imparting information towards national level? Well, they'll have the backup from Health Watch England, which will provide general advice and assistance to local Health Watch and a route to influence national issues where necessary. Health Watch England can also make a formal advance to a local authority where the local Health Watch is in difficulty. So there's going to be lots of support out there. And local Health Watch will be a clear, recognisable entity through use of the Unified Health Watch brand to help it make more accessible to local people. And that's what we want, because actually it's the voice of the people that can make a difference. So I thought, well, what's going on in Durham? So I had a look at North Durham Clinical Commissioning Group, and actually, is anybody here from the commissioning groups? Because I think this is a really very good website, and it talks about what the Clinical Commissioning Group is, what it does, what responsibility it has. And clearly they want the involvement of local people. And one of the sections within the website is about involving me, how local people can actually get involved and put their ideas and any issues forward. And so here's Health Watch County Durham, and again it talks about what they are, what they do, how people can get informed. So there's lots of information out there about how people can get involved and help working towards making a difference. So what does Health Watch do? They gather together the views and experience of local people and see what is good and also see what isn't good, what's working well and actually perhaps what's not working well. And also then that leads into the commissioners to help inform them about what needs to be done. And also linking in to the Quality Care Commission and Health Watch England. And also they have a power to enter and view, to go to see for ourselves if things don't seem to be right. And what does it say? Well, every voice counts, and that's really, really key. People sometimes think, well, nobody will listen to me. You know, I'm not important. Everybody is important, and that's the key. And certainly in Health Watch County Durham, they seem to be really, really keen to take people on board. They tell us they're very friendly, which is very nice, accessible, approachable, practical, dynamic, and acts on behalf of local people, and can help shape and improve the services and engaging in people in the community. And I think as individuals, we want choice. We like to be able to choose how we can access healthcare, and the local services that fit in with our lives. Perhaps those of us that work, having a clinic on a Saturday morning or of an evening is actually quite helpful. And so things like that, how services meet the needs of local people, is really, really important. And also put investment in deprived areas so people aren't able to actually access services. And we know that mental health issues can be a problem in some areas. So this is another website I looked at from Durham Dales, Essington, Sedgefield Clinical Commissioning Group. So there's lots of interest out there to try and engage with people, to try and get people on board. And this was actually a call to action. They wanted people to come and speak to them, to tell them what the issues were, how things can be improved, what's working well and what's not working well. That then links into health and wellbeing boards, and they're set up with a core membership with mutual obligation to link in and help everything get all joined up, and particularly looking at joint commissioning and integrated provision of care, and strongly involve users and the public. So health and wellbeing boards work in partnership with a joint strategy to underpin commissioning and services. So you can see actually how having a voice through local health and wellbeing boards and Health Watch can actually then work towards the commissioning agenda, and certainly looking at enabling service change when required and engaging with the public and service users, and importantly listening to what people say. And this is, again, quite complicated, but you can see how everything starts to become joined up. Health and wellbeing boards link very strongly with the NHS Commissioning Board. They have a key relationship, but it's important that they have a sort of a symbiotic relationship where they need each other in terms of helping ensure that services that are provided at a local level meet the needs of local people, and link in with networks and senates. So there's now great opportunities, more so than when I was actually working within the NHS. I think if we had this opportunity to have an input and work towards changing practice, then I don't think I would have been so disenchanted with the NHS as I was then, as I am now. And certainly there's a great emphasis on the user voice. So those of you that are in user organisations or patient groups, you're actually quite powerful. You're actually more powerful than you probably realise. And I think it's about how we can all work together and drawing on existing resources to actually empower and take things forward. I think the issue is as well as there's the opportunities, that there's also challenges for people, because we know Health Watch is being seen as the only voice, the safe voice. So it's important that we link in with Health Watch so our voices are actually heard. And it may be that Health Watch is absorbing a lot of resources, but certainly there are routes and how they influence specialist services is still unclear. And we know in a lot of areas, specialist roles, and particularly roles of specialist nurses, is being looked at in terms of value for money, which is obviously a key issue in the current NHS climate. And we know that community commissioning groups perhaps focus more on statutory partners than voluntary organisations. However, we know that voluntary organisations are quite powerful, and it's about how we can work together. And we know that Health Watch needs to have really effective networks, but as voluntary organisation patient groups, we're well used to working, and certainly within my organisation, we have a whole network of other charities and other voluntary organisations that we link into. And I think that is one of our strengths. And I think the Health and Wellbeing Boards need to take a broad perspective. Often within the NHS, it was very much the medical model where the emphasis was on diagnosis. And I'm very pleased to hear, particularly from this morning, about we're now moving towards a patient-centred care, because we know, again, that's a win-win for everybody, and it just makes sense to focus on the patient, because everybody's different, as we've heard. You may all be sitting here with the same diagnosis, but it's going to affect you everybody differently. And I think for us, involved with working in patients, particularly in the community and with their families, we see this whole person and how health and social care actually joins together. So there's lots of ways that you can get your voices heard, and certainly there's lots of information out there for you to find. But I think the key take-home message that I think we've heard from everybody is that your CCG needs you, so get out there and make your voice heard. Thank you very much.